Yes. Yes. Good afternoon, all of you. So we'll start. In the previous class, we have ended up to the oral care of conscious and also unconscious, right? So today we will discuss about the dentures care. We will discuss about the dentures care, and another one is that is bed bath. Okay. So in that only the types, purposes, and also about the tub bath. Okay, tub bath, or we can say shower. So that procedure only we will discuss. Okay. So in the bed bath only the purposes and some key points. Later on we will discuss about the procedure. Okay, are you understanding? So in this class these are the main things which are present in this class. Okay, so firstly we will see what is the care of dentures. Here the care of dentures means one who is having comatose patient, or else we can call as a unconscious patient, or else others like a paralysis patient. So if they are paralyzed patient, so they can't able to take care of their dentures if they have dentures, or else we can say that is old peoples. Okay, so for them, if they are not able to take care of their dentures while they are admitted to the hospital for the purpose of the operation, so that time what we have to do? Yes, sit properly. So what we have to do? So we need to give the care, isn't it? So it is for the patients one who is confined to the bed, or else we can call that as a comatose patient. So confined to the bed means bedridden patient. Okay, and one who is weak, he can't able to take care of the dentures, or else one who is admitted to the hospital for the purpose of operation. Okay, so for them we are giving the dentures if they have dentures. Okay, so artificial dentures if they have, that time we need to give the dentures care. Are you understanding? Sir, how we have to give the care? So the simple thing about this procedure is you take the dentures and you have to soak that in the warm in the water, or else you have to soak that in a normal saline. That's it. And you should not use any abrasive cleanser. You should not use any abrasive cleanser. Sir, what is the meaning of abrasive? See here, abrasive means it's a scraping. Okay, what does it mean? It's a scraping, or we can say the scratching type of solutions we should not use. Abrasive solutions we should not use. The cleanser, or you can call it as a solutions. Which type of solutions we have to use? That is non-abrasive solutions or non-abrasive cleanser we need to use. Is that clear? Everybody understood? Okay, so how they have soaked? They have soaked in the water. Okay, or else we can call this one as that is normal saline. Clear? Okay, so coming to the steps, some simple steps they have given. So that one we will see. First we have to do the hand washing. So it is a general to every procedure. So before assessment, before planning, whenever you are going to touch the patient, before the touching the patient you should wash the hands. That is general. And gather articles which are necessary for soaking the dentures, or patting the dentures, or brushing the dentures. Okay, so normal toothbrush and normal toothpaste you should not use. Okay, so the dentures brush will come, and the toothbrush, that should be toothpaste, that should be non-abrasive. Okay, actually here the toothpaste itself they don't use. Then what they will use, sir? As I said earlier, that is non-abrasive cleanser or non-abrasive solution. Is that clear? So we will not use the toothbrush, we will not use the toothpaste, we will use the cleanser solution. Okay, that to be non-abrasive. Is that clear? Okay. So hand washing we have done and gather the articles which are needed, and we have to maintain the privacy, right? So which one you have to use? We have to use the denture brush, okay, and we have to use the non-abrasive solution, or we can say non-abrasive cleanser. Sir, why we have to not use the regular toothpaste? Because it is scratching, or else it is having scraping quality. Scraping quality means that may acidifies or that may dissolve the artificial dentures. Is that understood? Yes. So this is the first step is hand wash and privacy, gather articles. Second step is use the articles, and third one is dry and inspect. Sir, what to dry and what to inspect? Dry, pat means what? Pat means gentle. How you have to handle it? You have to handle it very gently. If you took the with the help of gloves, you have to wear the gloves and you have to take the dentures, and now you have to pat it, or else you need to gently, you need to dry it. Clear? You should not give the more pressure, you should gently, you need to pat that. Clear? Pat or gently. Clear? So with the help of the gauze, that to be dry gauze, okay. So inspect, so we have dry. So in the third step what they are saying, dry and inspect. In the dry we have to dry the dentures with the dry gauze. Clear? What to inspect, sir? We have to inspect. Inspect means we need to observe. After drying, what we have to inspect? We have to inspect the crackles of the lips, and we have to inspect the redness of the mouth, and we have to inspect the ulceration in the mouth, okay, before insertion or after taking out of the dentures. After taking the dentures out of the mouth, so you need to check all these things. That is what to inspect, that is cracks in the lips, redness and ulceration. Is that clear? Okay. So fourth step is label and store safely. Sir, what to label? Suppose you have taken the patient number 1, that is his name is Sharma, okay, next another name is something like Karma, you can say, or else you can say that another name. What is your name? Drishya, okay. Sharma is here, Mr. Sharma is here, Miss, what's your name? Drishya, okay, Drishya is here. So Drishya's dentures, that means Drishya is, you think she was 88 years or 89 years, and Sharma, the old age people only they have dentures, no, that's why. Okay, we have taken two patients dentures now. This patient dentures have different size and this patient have different size, right? So now we have to label that to know which dentures belongs to which patient. Are you understanding? So that's why what to label, we need to name on the container. So which container you are putting that dentures, that in that container you need to label that as a Mr. Sharma or Miss Drishya, right? Okay. Store. So don't store only the dentures in the bowl, you should store with the water, okay. So with the water or normal saline you need to keep to prevent the dryness, or else to give the moisture, okay, to avoid dryness or to keep moist, or else these are the things in the fourth step. Do you understand this one? Now the fifth very important step here, we should not discourage the patient, okay. So why, what not to discourage and what to encourage? So discouraging the patient will decreases the self-esteem. Suppose if the patient is asking for the dentures, that time you should not discourage, okay. They want to talk something else, without the dentures they can't able to talk, so that time you provide the dentures when they ask. So keeping the dentures is not a permanent, okay, it is only for the temporary, it is only for the care like operations if they are going to the OT. So that time only we have kept aside in the operation theatre or else in the out of the OT, right. So why we have to keep it outside? Because in order to prevent the complications like aspiration during the operation, right. So don't discourage the patient, clear. When they ask, give it, clear. And what to encourage? Use the dentures when after the procedure, if they are going to talk something else, you are not understanding, that time don't say it in a negative way, you say it in a positive way, that use the dentures. Clear? So here what is the use of the dentures then? So it is used to better chewing and better speech. Clear? And it influences the self-esteem. It is the highest, topmost thing in the Maslow's hierarchy, isn't it? So first, the base one, there is a physiological needs must be fulfilled, isn't it? In the top one, that is self-esteem. Clear? So in order to fulfill the self-esteem, we are giving what? So we are using the dentures. Are you understanding this one? Yes, last bench, understood? Is there anyone sleeping there due to the last period? No one is sleeping now? Yes, we'll get into the next one. So, okay, we have encouraged to use the dentures. We have understood the uses of the dentures. And we have, next one, we'll get into the, what is the nurse's responsibility? What is the nurse's responsibility? Is that not getting? Okay. Yes. So, what is the nurse's responsibility? Nurse's responsibility is to, okay, handle and clean the dentures as instructed after the operation. Okay. So, after the operation, we need to handle it as I said about whatever the steps I said, that one you should do. Clear? And ensure the proper fit into the oral cavity. Suppose, hello, what happened to you? Stand up. Stand up, ma. So after the operation, we need to encourage the patient to use the dentures. So for that, you should not force the dentures to fit. It should be appropriate size and it should be appropriately labeled to the confined patient. And so that dentures only you should give to the patient, right? Sir, where it will be done? It will be done in almost oral surgery patients, especially in geriatric hospital. That means we can say that is old ages, okay, old age hospital. For them, they will do this. Clear? And when not in use, keep it in a filled with a saline, okay, when there is not in use. And this should be temporary, not to be permanent, okay. Next. So before operation, you should keep it in a saline. After operation, encourage them to use of the dentures, and before that you clean it after taking out of the saline. Okay, after taking out of the saline, pat it gently and check the label and fit it properly. Clear? Okay. So document it. Sir, what to document, sir? So here there is a, when you remove the dentures before the operation, that one you should document. And when you are instructing to the patient after the operation, that one also you need to write the what in the timings, you need to write timings and date you should enter, and record the patient's response, what he was responding when you are saying that. Okay, that one also you need to note down. Sir, why we have to do this one? Suppose if anybody higher authority asks you, so why you are forcing the patient? So that time you can have the record and you should say, I have a legal protection, I have documented it, so you can't able to do anything from this documentation. I have a pure documentation, with this I am legally protected. Are you understanding? So what the nursing officer will say, I am legally protected, so I have documented it and I have recorded the response from the patient, so I have a legal protection. Whatever the patient says, you should not agree that. Clear? Are you understanding? Yes. So this is about the what? A dentures care. In the dentures care, I have said this already. The prepare, you need to wash your hands and necessary articles you need to gather and provide the privacy. This is the first step. Second step, as I said, you should clean it, isn't it? So clean it with a dentures brush, and also you need to clean it with a, is that coming? Yes. So clean it with a dentures brush and also rinse it with a cleanser solution. Which cleanser solution? That should be non-abrasive cleanser solution, isn't it? Non-abrasive cleanser solution. Okay. Next, pat it, dry and inspect. So you need to pat with a dry gauze or a dry towel. Clear? So it should be done gently. It should not be hard. Clear? And label it. So what is the name? Mr. Sharma and Drishya, right? That. So you need to label it correctly. And safe place you need to keep it. Clear? And encourage the patient to use. And you need to encourage the self-esteem of the patient and encourage for the better chewing and better speech. Clear? Handle it carefully. Next one is, so before operation you need to remove, this one is the second, this one is first. Don't add the second one to the same one. Okay? Are you understanding? Next one, so this one due to the technical issue. Okay? So again the tooth came. Here tooth is not there for the patient, or a single or one or two teeth will be there for the old age people. They have shown very young age, actually old age people you have to think. Clear? Understood? Yes. So document it. So when it is cleaned, when it is inspected, and what where you stored, which solution you stored the dentures. Suppose if you store in the isopropyl, okay, or else we can say that is 70% of isopropyl. Okay. So bacterium, what we say that? Sterile, I forgot it. Can you say that? So what we have to say, that hand rub, we will use the hand rub solution, no? So that one, can we store in the acid based content? No. Why? Because it will make the abrasion. Can we store in the hydrogen peroxide? No. It will also make the abrasion. Can we store in the KMNO4 solution? No. That one also will abrase the dentures. Clear? So record the patient's response and note it down. Clear? Everyone understood? Okay. So this is about the dentures care. Next we will enter into the skin bath. Sir, what is the skin bath according to the WHO definition? So we can say that is, we have to give, first we need to give the comfortness to the patient. So after giving the comfortness, we need to cleanse the skin. So why we have to cleanse the skin? So we have to remove the debris, that means dead skin cells. We have to remove the dead skin cells, and we need to remove the dirt from the skin, or else we need to remove the sweat and sebum. Okay. Another one is bacteria or viruses, or else the microorganisms. So in order to prevent from all those things, we need to do this one, which is, that is skin bathing, right? So everyone know about the bathing, right? Yes. So we are, while promoting the comfortness, we are doing these things, cleansing the skin bath, and also for what purpose we are doing it? To remove the dirt, debris, sweat, sebum, and bacteria, viruses or microbes. Clear? Okay. So what are the purposes of the skin bathing? That is to cleanse the skin, to promote the comfort, to stimulate the circulation. So if you are giving the cold bathing, so that time, so circulation will be less, but tachycardia will occur. Okay, tachycardia will occur. Are you understanding? For the cold bathing. So for the hot water bath, what happens? For hot water bath, there is a more vasodilation, and the circulation decreases, and also very importantly, heart rate decreases in the hot water bath. That's why we need to give the hot water itself, but that should be 105 degree Fahrenheit. Okay, what is the temperature of the water? That should be 105 degree Fahrenheit. Don't write instead of writing 100 degree Fahrenheit, don't write Celsius. Clear? Celsius is more temperature. You write 105 degree Fahrenheit. In Celsius we can say that is 45 40 or 41 degrees Celsius. It will comes, I will tell you. Okay. So to promote the comfortness, to stimulate the circulation, to remove the waste products, isn't it? So to promote the rest and sleep. So if the patient is so much what we can say, that is so much fatigue, that time what happens? So if you provide if you provide this skin bathing procedure, that time what he feels rest and sleeping well in the night, right? So or otherwise he will get a insomnia. Okay, what he will get? Insomnia. What is the meaning of insomnia? Sleeplessness, or else we can say that is sleeplessness, or else decreased, or else we can say lack of sleep. Clear? That is insomnia. Okay, to promote the rest and sleep, only 15 minutes. Okay, so I will complete this one, or else I think within 15 minutes only we will complete, so don't talk. Clear? Okay. So to remove the waste products, to promote the rest and sleep, to observe the condition of the patient skin and abnormality, right? So sometimes there may be patchy skin, sometimes they have a lot of dirt. Okay, so we need to see the abnormalities also. Sometimes redness will be there. If the redness, if it is there, don't scratch it more. Okay, roughly you should do according to their preference, should not go. Okay, suppose the patient says that I need only the Santur soap, okay, or else he will say I only need Lifebuoy soap. So you should not go according to them. So what the doctor has prescribed, according to that solution you need to use. Okay, you can use solution, or else you can use the medicated soap. Okay, and if you are using the medicated soap, that one will be called as therapeutic bath. Okay, that one will be called as therapeutic bath. Clear? To promote the sense of well-being, you should feel that I am okay with this. Okay, I am okay with the hygienic practices, so that you will feel well-being, right? Next, last one is to prevent the infections. These are the important purposes that you should keep it in remember. Understood? So next one is, what are the types of the bath? What are the types of the bath? First one, complete bed bath. Sir, for which patients we are giving the complete bed bath? So complete bed bath means he can't able to reach to the bathroom. Okay, so for them what we have to do? So we have to give the care at the bedside itself. Okay, so for the unconscious patient, for the quadriplegia means complete body get paralyzed. All quadri means all four legs, and also the axial body, trunk, so that is also get paralyzed. Which one is responding? Only the head is responding if it is. Okay, may or may not. So that is called quadriplegia. Are you understanding? Okay. So give the patient who are totally unable to care themselves and they are remaining in the bed only. For them we are giving this care. Which care? Which type of bath it is? What type of bath it is? Last bench, second one. Last second bench. What type of bath this one is? That is what type of bath? Complete bath. Okay. So what are the two examples I given? That is unconscious patient and also unconscious and quadriplegic patient. See, if you keep on talking, I will take the class after the video ends. After the video ends also, I will take the class for more than half an hour. If you wish, you can talk. Yes? Okay, getting into the next one. Second type, that is partial bed bath. What is the meaning of partial bed bath? That is for the patient who is only the one or two parts get damaged. Okay, so they are taking care of it. Okay, so post cesarean section, that type of patient. Suppose LSCS is happened, lower section cesarean section is happened. Okay, cesarean surgery has happened. Okay, that time for such patient That means for the mother at day 1 only need care. For them what you will do? Partial bed bath you will give. That means they are partially dependent and partially they are independent. Clear? Off the fan. Off the fan. Yes. So for the traction patient also, bandages patient. So one who is applied with the bandages, okay, let's suppose leg fracture if it has happened, that time traction we will apply, right? So for them we will give the partial dependent bath, okay, partially dependent bath or partial bed bath we can say, right? Okay. So next one is tub bath. So tub bath for them where we are immersing the patient, not fully, okay. So fully we are immersing means we are killing the patient, isn't it? Are you understanding? So half of the bathtub we need to fill the water, and later on we need to tell the patient to take the tub bath if they are fully independent, or else if they are only certain joints that is having the pain, or else the patient with the rehabilitation. Rehabilitation means they are gaining normal range of motion. Suppose the physiotherapist they are doing for a prolonged period of therapy. Now, Drishya, don't sleep, ma. And you people are sleeping like this means how can I? Huh? In first bench itself, huh? You are sleeping. Yes. Is there any artist people still they are sleeping in a different way? Any artist? You both are already got coma, I know. Yes. See, in the coma I said, in the stage of coma I said her to off the fan, and they partially offered. What about this one? Off the complete room fan. Hello? Off it. Still she is in coma. Here. Okay. Yeah. Now it's nice, no? Right? So tub bath. So tub bath for which type of patients we will give? Rehabilitation patient. That may be alcoholic rehabilitation. That may be psychological rehabilitation. That may be physical rehabilitation. Physically, they have already got surgery. After 1 year, he came for resurgery. That means they have to take out the rods from the fracture. Okay, for that they have came, isn't it? So that time for the rehabilitation purpose, so we can give the tub bath. Okay, so here in the arthritis and rehabilitation are the two examples, right? Shower bath. So shower bath who needs only minimal assistance, for them we will give. That is stable post-operative patients, and also for the patient recovering from the mild illness, for them we will give, right? There is no need assistance or little assistance they need. Okay. Next, so little assistance means providing the towel or providing the drapes which we can make the cover the body of the patient. Okay. So for that we have to do this bench. Yes, in the fifth one, therapeutic bath, as I said, treatment purposes. Okay, for the burns patient, for the ulcer patients, we will give this one, therapeutic. Okay, so particular soap or particular solutions they will use for the bathing, right? Clear? Yes. Next one, what are the key points? So you need to maintain the safety. You should not give more than 40.5 degrees Celsius, or else you should not give less than that. If you give more than 105 degree Fahrenheit, what happens, sir? Already he was burned patient, he will get more burn, that's it. Clear? So that's why safety is very important. And when you are taking the that means you are taking the patient to reach bathroom, right? So in that, when you are assisting or when you are helping the patient, that time you should lower the side rails, okay, at both side, clear. So where you are going to take, suppose if you are not lowering the side rails, what happens? There may be chances of injury, right? So you need to lower it and you need to ask them to reach to the bathroom, right? Next one, bed rails must be up when away from the side of the bed. Suppose if they are coming after they are if you take the patient, that time you should raise the bed rails, okay. So next one is, place the bed in the lowest position if you leave the patient from the bedside, right? Are you understanding? Next one is, provide the privacy. Curtain you should make all the way, so you need to make it. And where if you are draping that one and only expose, this is after one, okay. This is after the bath. This is post procedural part, okay. These are key points only, right? So these are key points. This is not in the steps wise, okay. So in this one, what they are saying, provide privacy. Even before also, after the bath also, you should provide the privacy, okay. While giving the bathing in assistance, full assistance or partial assistance or minimal assistance, that time also you need to provide the privacy, that is universal, right? And we have to prevent the chills. We need to prevent the chills. For that, we need to close the door of the bathroom, and you should close the windows of the bathroom, right? So if it is there. Next, why we have to do that one? Because to provide the warmth by decreasing the drafts of the hair, okay. Are you understanding? Next one is, fourth one is, encourage the independence. If they want to do alone without any assistance, they want to do alone bathing, means you need to leave them alone, clear. And don't force them to assist, even they can do independently, right? So that is the encourage the independence of the patient. Next one is, what are the skills? The last topic from this class is skills. This procedure, providing the tub bath or shower, this is the last topic, so we will discuss. So you need to provide the towel on the floor, they have said in your textbook. You can keep it on the table also, right? So you keep the towel on the table, but non-skid mat will be there, no? So that one should be on the floor itself, okay. And why we have to do the non-skid mat? In order to prevent from the skid, okay. So in order to prevent from the skid and prevent from the fall of the patient, okay. So next one, so gather the supplies which are needed for the patient, okay, to reach the bathroom, okay. Suppose from the bed you are reaching to the bathroom, that time you should drape the patient. Drape the patient means you need to cover the body of the patient. So in order to prevent the what? In order to prevent the hypothermia, or else we can say to prevent the chills, where it is, okay, here. To decrease the chance of chills, we need to drape him, clear, okay. So, and place the occupied, so place the occupied as a sign at the doorstep, or else demonstrate using a call bell system. Suppose call bell system means you know well, isn't it? So door call bell system is also there, and if it is open, then you should make it as a closed, okay. Why we have to make it as a closed board or else occupied board? Because the patient is taking bath inside, okay, no one has to disturb that. So for that you are doing it, clear, understood? Sit properly, sit straight, yes. So next one is, fill the half tub. As I said, half tub you need to fill, okay, and you need to check the warm water, okay, check the warm water whether it is 105 degree Fahrenheit is there or not. So why we have to check? We have to check because in order to prevent from the burns. Sometimes what happens, it will gives the more temperature, increased temperature more than 120 degree Fahrenheit. So that will makes the further burning for the therapeutic bath, isn't it? So that's why we need to make the patient to make the half tub of the water and also warm water, that is 105 degree Fahrenheit. Clear? Okay. Decrease the chance of falls and also decrease the chance of immersion. Okay. So if you fill full tub, what happens? He may fully immerse into the bathtub. Okay, and help to reach all the toiletry items, or else the preventing the hard to reach. Okay. So you need to keep it there only beside the bathtub. Why? Because if he need, he will take there. Otherwise, if you keep there and he will be like this, and afterwards he will fall in the bathtub or else out of the bathtub, right? Yes. So this is the fourth point. Next, fifth point, 20 minutes only you need to give the patient to take bath. More than that you should not give. Okay. And in that 20 minutes also, every 5 minutes you need to ask them whether they are okay or not. Why? Because if you are okay, so if you have to knock on the door and you need to ask them, are you okay, are you doing well? So you need to ask this one. Why? Because this warm water is there, no hot water is there, no. There may be chances of making the patient's syncope. Syncope means all the blood vessels will be dilated due to the hot. Okay. Are you understanding? That time what happens, the patient may go for decreased neurological function. Okay. When you ask them, if they don't respond, that means the patient, something danger has happened. Okay. So that every 5 minutes, that is a nursing responsibility to knock the door and to ask. Clear? Next one, assist the patient in the tub if they need. Okay. Assist the patient if they need. If they don't need, every 5 minutes you need to knock the door and you ask. Okay. And later on, you need, after the cleaning, after bathing, you should provide them towel, or else you need to provide the drape. Okay. So in order to prevent from the chills and in order to dry the patient. Clear? Are you understanding? Yes. And if it is need any moisturizer, if they want, then you can, not if they want. So according to the therapeutic purposes, if they need, then you have to apply. Clear? Okay. So clean the bathtub is very, after that patient has finished, patient Sharma has completed his bathing. Clear? Now you should wash that bathtub. Why we have to clean that bathtub? Actually not we have to instruct the Aya aunty or someone else. Just we need to instruct the Aya aunty or someone. So to clean that. Here they have given the step for the nurses itself. So in theoretically you have to write this one. So don't feel of low self-esteem for yourself. Okay. So you just write this one, and in the practical that will be different according to the different institution, right? Yes. And lastly, you need to document the type of the bath they have taken, whether which type of the bath. So kindly tell me what are the types of the bath we seen? Complete bath, partial bath, tub bath, shower bath, and last one is therapeutic bath. Okay. So this is about the today's class. Further class will continue in the next class. So this is the class 4th we have completed. Thank you for listening the class.